Everyone, this is Marcia Noel, Assistant to the City Manager, serving as your moderator for our call. Thanks for joining us again for our bi-weekly COVID-19 community teleconference, where you will receive critical information on what's taking place in regards to the pandemic and city operations and what we are doing to serve you during this hour. Before we get into it, I would like to encourage you, whether you're listening by phone or online or TV 18, to please share this call with everyone else that you know. Ask them to join us. And if you are online, feel free to share this video. Tonight, you will hear from members of our Emergency Operations Center, which includes the City Manager, Operations, Health and Human Services, Finance, and Communications. So without further ado, we will hear initial remarks from our City Manager, Jonathan Evans.
Thank you, Ms. Noel, and thank you, members of our community. Obviously, we are still in this, and we're continuing to do everything in our power to facilitate and assist our community as we make our way through the multiple iterations of our operations morphing to be able to address the needs of the community. We are still providing testing. Testing is still occurring at the Wells Recreation site, but you're seeing that site primarily utilized as a vaccine distribution site for the city of Riviera Beach, working in collaborations with the State Department of Emergency Management. We still have food distributions, which are ongoing and have been ongoing since March of 2019. Also, we're still doing mass distributions for our employees and possibly looking at the feasibility of moving forward to provide additional masks to the community. Thus far, we have administered approximately 1,400 first dose vaccines to our community, and we have been quite successful in doing that. If I'm not mistaken, we are probably the number 2 agency in Palm Beach County that's a municipality as it relates to the vaccination of persons in our community. I think we have actually surpassed the town of Palm Beach, who received the first initial distribution of approximately 1,000 vaccines. Today, we were actually able to provide the second dose of vaccines to members of our community at Heron Estates. We also provided them with literature as it relates to the vaccine. One of the things that's important for persons to know, and we are going to be doing this at subsequent second dosage of vaccination opportunities, is providing literature to our community that if you receive and when you receive your second dosage, you are anticipated to potentially see flu-like symptoms or symptoms associated with COVID. That's about 50% of persons that have received the vaccine. So one of the things that we are informing folks, if you're not feeling well, if you're not feeling as you normally do, to certainly do not hesitate to utilize 911 if at all possible, if you have to utilize that means. But there's also information and numbers for you to call, and please consult with your primary care physician. That's important. But that is a good sign. If you're experiencing symptoms, that means your body is actually responding to the vaccine and actually figuring out the genetic composition of the virus to be able to combat it. So that is your immune system that is firing up to be able to follow the genetic map of COVID to be able to combat it. So that is something that's a good thing if you are exhibiting symptoms, all things considered. One of the things that we're certainly seeing and hearing from folks in our community is, when is the information or the persons that are able to receive the vaccine going to change? Right now, we are moving under the governor's executive order 2315, which prescribes exactly the process that we are to follow. The distributions that we've been able to do in our city that are closed points of distribution or open points of distribution have been in collaboration with the state, and we've also done some on our own. But we have very prescribed practices that we must follow. We have to adhere to that executive order. We've had people that have come to the site that have provided letters from physicians or what have you. If you do not fall under the category of persons over the age or 65 or older, we cannot administer the vaccine unless you are a person, a healthcare professional that has direct patient contact, and you have some type of medical licensure or certification to confirm that you are in fact a medical provider. The other distribution sites that you're seeing pop up are at long-term care facilities. If a person is of the vulnerable population and extremely vulnerable, and your physician is recommending that you obtain the vaccine, hospitals are the only entity that can administer the vaccine based on what they deem appropriate. So your hospitals have been provided allotments of the vaccine. That is something, that conversation that you need to have with your primary care physician or your physician nonetheless, to be able to see if there's a possibility or feasibility to obtain the vaccine through the hospitals. But we have to follow the executive order to the T, because we want to make sure that we continue to get additional allocations of the vaccine. One of the things that's very important to know is that there is still a lot of conversation that's happening with the county health department. I've had multiple productive conversations with the county administrator about opportunities for long-term pods to be opened in our community. Right now, there is discussions and there is opportunities that may present itself with regards to a site in the greater Riviera Beach, West Palm Beach area to be a mass distribution site. And what I mean mass is a large number of persons to receive the vaccine. The county has spooled up their operation over at the Fairgrounds for the purposes of providing the vaccines to persons in our community, but we're also looking at an opportunity to have a site open up that can provide the vaccine to well over 1,000 people per day. That is the long-term hope, and we're still moving towards that. You'll also hear on the call today that we are tracking some efforts that the Biden administration is trying to push through in collaboration with the congressional leadership to see if there is some assistance that can be provided to communities that are all strapped as it relates to trying to combat this virus from multiple angles. So all in all, we are still doing everything in our power to obtain the vaccine. There is not a day that goes by that we are not trying and advocating and trying to build the best system possible to show the county as well as the state that we are capable and able of providing the vaccine to our community. But understand there's 38 municipalities in Palm Beach County. There's well over 1.5 million people. So obtaining this precious commodity is certainly challenging, especially when you have the Walmart Corporation that will receive an allocation here in the state, and you have Publix that is also receiving allocations. Originally, we were hoping that we would get some distributions directly to the municipality, but as you're seeing the vaccine being provided to these entities, our ability to obtain the vaccine is becoming somewhat more challenging. And the vaccine and the distribution of the vaccine is handled by the governor's office in working in close collaboration with the Florida Department of Emergency Management. We were fortunate to have good connections to our state senator's office to be able to be successful in obtaining the vaccine. So your community and your staff is still fighting the good fight. We're doing everything in our power. I cannot emphasize enough, continue to watch Channel 18, subscribe to Code Red, which is our mass notification system, as well as following what's happening on our social media platforms. As we get this information, we try to push it out as quickly as possible and be able to open up our sites as quickly as possible. But please note that sometimes we're only getting 24 hours notice that we're going to get an allotment of vaccines, and it's only a small number. So it's really hard to be able to have an opportunity for the community at large to participate. But we are trying as best as we can. The last time that we did open the lines, we had well over 100 calls in a span of 4 minutes. And so that's how quickly things move, especially when you have something that is in high demand. Based on some information that we're also hearing is that there is going to be subsequent vaccines that are provided to other individuals, and what the standard is or what the age group is and what that looks like. The guidance is still outstanding, so we're still waiting to hear on that. But we can anticipate, hopefully, in the next couple of weeks, moving into other age groups or other categories that the governor and his office deems to be appropriate. So, again, we're continuing to move through this as quickly as possible. And I do want to continue to commend the staff for the efforts that they've been doing for well over a year now as it relates to providing services to the residents that are uniformly enjoyed, as well as to combat this virus as best as we possibly can. At this time, that concludes my comments. Ms. Noel, I turn the meeting back over to you.
Thank you, Mr. Evans. Next, we're going to hear from our Operations Section Chief, Chief Kurt.
Good evening, everyone. I'm sorry it's been a long day. For everyone to know, these are unprecedented times. The city has been actually functioning in a state of emergency for well over a year now, which in history has been the longest activation of not only our EOC, but operating under a state of emergency. And it is going to be a long road still ahead of us, but we are making some traction. As I provide these numbers, I ask everyone to grab a pen and paper, pencil and paper, as I will be providing some useful information as I go through my report. As I always do, let's go ahead and discuss the numbers. In the U.S., 27.3 million individuals have contracted COVID-19 since the onset of the pandemic. There's also been a total of 471,000 deaths. It is anticipated that we will see over 500,000 deaths by the end of February. Just in the last day, there have been 94,893 new cases in the U.S. in one day, and there have been 3,255 deaths in one day as it relates to the pandemic, just to make sure we keep this pandemic in perspective. In the state of Florida, we have seen a total of 1.8 million cases of COVID-19. We've seen a total of 28,691 deaths. And the one-day totals in Florida is we've seen a one-day gain in the number of new cases of 7,537. And in the state of Florida, 160 individuals died yesterday as it relates to COVID-19. Palm Beach County, we've seen a total of 112,000 cases, and we've seen a total of 2,294 deaths. The census tract data that we monitor to bring the information a little more specific into what's happening in Riviera Beach is that census tract data. And while I'm happy to say Riviera Beach this week has no hotspots, just about every census tract in Riviera Beach registered anywhere between 14 to 23 new cases. And we have roughly 10 census tract areas within Riviera Beach. So while we don't have any hotspots, we do have a city that should be concerned with the information I'm seeing on the census tract data. And this furthermore enforces the importance of physical distancing, wearing your mask, sanitizing your hands, enhanced cleaning procedures. So we want to make sure that we continue to impress that upon our community. We must follow those CDC guidelines. The most important topic in the conversation that has dominated most of the conference calls that I've been on is vaccination data. So we're going to start off talking a little bit about the data. We did have conversation over the last couple of weeks about some of the disproportionate numbers as it relates to minority communities such as ours. The governor, working with our senator's office and working with Palm Beach County, put forth an initiative to send 6,000 vaccines to Palm Beach County that were allocated specifically to minority communities. And over the last week, we've been able to open 7 vaccination sites, one being in Riviera Beach. There was one in Gaines Park. They did one out in Pahokee and Belle Glade, and some other areas throughout Palm Beach County where over 5,000 individuals were vaccinated in these communities. What that's done for the numbers, and we're going to be using the 2010 census tract data. In Palm Beach County, there are 346,044 residents over the age of 65. We were able to vaccinate 154,671 residents over the age of 65. That's 45% of the 65 and older community that has been vaccinated. And considering the national average of individuals who want the vaccination is at 20 to 30%, seeing 45% of our seniors vaccinated is a tremendous accomplishment. As it relates to the ethnic breakdown, 48% of the 65 plus community that have been vaccinated are white, 17% black, 23 Hispanic. Now, mind you, minorities make up 10% of Palm Beach County's population of 65 and older residents. So the initiative the governor put forth with the support of the Senator Powell's office and working with individuals in Palm Beach County, such as Mac Bernard, we see our numbers at 17% and 23%, now reflecting the numbers we would want to see, but our work is still not done. In totality, Palm Beach County has vaccinated 13% of its residents. That's better than the 8% in Broward County and the 7% in Dade County. While they have a bigger population, I can assure you that Palm Beach County leads the way of counties in the number of, or the percentage of individuals being vaccinated, not only in totality, but over the age of 65. So we've done a very, very good job as it relates to that. Riviera Beach, as Mr. Evans mentioned, is now beginning some of its second doses. We did an initial dose this week for 100 members of our community. We have 40 that were done today at Heron Estates. We have 500 that are being done for a second dose Sunday at Wells Recreation Center. On Wednesday, we have 120 that were specific to Riviera Beach residents. And we have a subsequent vaccination 3 weeks from now for over 600 individuals that we had just completed last Friday. So we are doing everything in our power to make sure that this happens. However, supply has not yet met demand. And when supply does start to meet demand, we find that Publix is now receiving 19,000 doses a week. Now, be mindful. If you are looking to obtain the vaccine, you are over the age of 65, you are a frontline healthcare worker. If you have not been able to get that through the city of Riviera Beach or through Palm Beach County, Publix opens their phone lines every Monday, Wednesday, and Friday morning at 8 a.m. So I would urge each and every one of you to look at that as an option for registering for the vaccine. When supply, again, does start to meet demand, we see that Palm Beach County Fairgrounds is now opening what they call a mega site. This is in addition to what we're seeing in South County, what we're seeing at FAU. We are now seeing the Fairgrounds open up, and the Fairgrounds are opened up this week on Tuesday. They began vaccinating 750 people a day. They will ramp it up to over 1,500 people a day, and they will maintain that average of vaccinating 1,500 people a day moving forward. If you are interested in registering for the vaccine at the Fairgrounds or in Palm Beach County, this is how you will do it. You can do it online. You can register at myvaccine.fl.gov. Again, that is myvaccine.fl.gov. Or you can register by phone if you don't have internet access or an email address by calling 866-201-6754. Again, that's 866-201-6754. And if you are looking for the latest updates for future vaccinations for Riviera Beach, you can sign up for Code Red. That information can be found on our website. We also have flyers at each one of our municipal facilities that if you want to stop in and pick up a card on how to register, you can do so. Please be mindful. There are over 10,000 individuals registered for Code Red. We have received concerns about individuals who received a Code Red notification, but by the time they called, all vaccinations were booked. We are doing the best that we can, but many times we only get 50 or 100 vaccines, and we literally receive hundreds of calls per minute. So just remain diligent, remain vigilant on all the options available to you. As Mr. Evans mentioned, Walmart is now entering the game. We've heard that Winn-Dixie will soon be taking registrations. We also know that CVS and Walgreens will also soon be taking registrations. We are working on a collaborative effort with one of our neighboring municipalities in West Palm Beach to open up a permanent pod site. That plan is being looked over by FEMA and the Florida Department of Health, and several different locations that have been identified for a permanent pod location to service members of our community. So we're very excited to partner with West Palm Beach, our neighbor, to do this for our community. And again, registration through Code Red is where we will be sending out this information. There is no known date for the next vaccination for first doses in Riviera Beach. We do not have that information. We don't know when it's going to occur. At this moment in time, there is nothing scheduled for a subsequent first dose vaccination. And if there is, our primary method of communication will be Code Red. We will utilize and leverage Facebook, and we will use Channel 18 and also our city's website. But I have to urge our residents, Code Red is where you're going to get the information. And please understand, it's not just for vaccines. In the future, if we have issues with hurricanes, and please don't be mistaken, we are in February. We are now away from preparing for what is hurricane season. This is how we would want to communicate to our residents. So thank you for your understanding. Your city is working very hard for you. We've been doing this nonstop for over a year now, and we will continue as long as it takes until every one of our residents who want vaccine. And with that, I turn it back over to you, Ms. Noel. That concludes my report.
Thank you, Chief Curd. Next, we're going to hear from our Health and Human Services Section Chief, Ms. Grimsley.
Yes, thank you, Marsha. Good evening, citizens and our council members of Riviera Beach. This is Valerie Grimsley, your YEP Director, acting as your Health and Human Services Section Chief. Just want to discuss a little bit about some changes with our food distribution. The city continues to partner with Feeding South Florida to provide community food distributions, but at this time, the food distributions are only held twice monthly at Wells Recreation. The time remains the same from 9 to 11. Food distributions are held the second and fourth Friday of the month, and this will continue until we or the city manager or Feeding South Florida decide that we will discontinue the partnership. We've seen an increase in our food distributions to our citizens, so we know that there's a need. We're currently serving 350 citizens every Friday. Food distributions are provided to our community. To move into our discussion about our COVID-19 testing, as the city manager and Chief Curd discussed, we are continuously providing testing. Testing is provided in our city 5 days a week through a partnership with United Clinical Lab. The testing is provided on Monday, Wednesday at Wells Recreation from 9 to 4, and on Fridays at Wells from 1 to 4. In addition, it's provided on Tuesdays and Thursday at James Ministries from 10 to 4. Testing is continuously provided in a drive-through fashion. So it is also provided in the back of your throat. So it's not a nasal swab. For those that are looking for nasal swabs, you can still go to some of our emergency or urgent care providers. Persons that want to be tested that have no insurance will be tested at no cost. Persons having insurance, please note that your insurance will be billed. Testing results are provided within 48 hours, sometimes 72 hours, just depending on how inundated the lab is at that time. Your results are provided by way of email, by phone if you are positive, and a text if you are not. Drive-through testing is also available at United Clinical Lab main office located at 2257 Vista Parkway in West Palm Beach. And just to get into a little bit of our vaccination process and how Health and Human Services is actually playing a part in that. Health and Human Services has provided and established a team to personally have a contact with our citizens that are registering for the vaccination appointments. This is done by way of phone call to our citizens to offer scheduling, date, and time. We also make an extra effort to make contact with our citizens to remind them of any upcoming second vaccination appointments. And as an extra layer, we're also mailing out reminder cards to our citizens for their second vaccination appointments. In addition, we're being available by phone to provide an extra layer of communication to our citizens just to ensure that they're comfortable with the process, because we know there's a lot of frustration and fear around the vaccination. So our citizens may have some extra questions or concerns related to the vaccination dates or even after that date, and they're welcome to give us a call, and we're open to that. In addition, per our city manager's office, our team is also providing citizens with a fact sheet that gives our citizens a clear understanding of what some of the symptoms that they may experience after the vaccine, and they have that fact sheet before they actually call our paramedics or their doctor's office. So just an extra layer to understand what the vaccination may be doing with their bodies, as Mr. Evans stated. That is our Health and Human Services report. It's back to you, Marcia. Thank you so much.
Thank you, Ms. Grimsley. Next, we're going to hear from our Finance Section Chief, Mr. Sherman.
Yes, good evening, everyone. This is Randy Sherman, the Finance Director for the city. As the manager mentioned earlier, we are following the American Rescue Plan, which is the plan being put out by the Biden administration. On Tuesday, the language relating to the local fiscal recovery funds was released, and let me walk through a little bit of what is being proposed in this legislation, as it does have a significant fiscal impact to the city. And I'm talking in billions, not millions here. This is billions. So the plan is it's $195 billion, $300 million that's going to get allocated directly to the 50 states and the District of Columbia. Those funds are being allocated in two parts. Every state and the District of Columbia will receive $500,000 up front, and then the balance of the money is actually going to be allocated across the 51 entities based on the average estimated number of unemployed individuals. So for a state such as Florida, where we have so much reliance on tourism, and you listen to stories about like Disney and other tourist destinations, our unemployment is probably higher than some other states that may be more reliant on office and industrial type work. So that money will be coming directly to the states and the District of Columbia. The next allocation that they have, it's $130 billion, $200 million that is then going to go to the cities and local governments. What they're doing is they're going to take the larger cities, the Los Angeleses, the New Yorks, Jacksonville's, Orlando's, all the larger municipalities, and they are giving them, spreading it out, $45 billion, $570 million to those larger cities. Now, what's more interesting is what comes to the smaller cities such as Riviera Beach. So that number is $19 billion, $530 million. That is going to get allocated out based on population. So obviously I don't have everyone's population have access to all of that information, but if we go through and we do some number crunching on that $19 billion number, we're figuring it's probably going to be somewhere about $50 per resident will receive a direct distribution from the federal government, which will put our distribution somewhere between $1.5 million, $2 million, that we will then be able to use to continue the programs that the other speakers have been talking about, vaccinations, food, and the like as we go forward. Now, that doesn't end there. There's also $65 billion, $100 million that is going to the counties. So again, if you recall back in March when the CARES Act was approved, Palm Beach County actually received $260 million. They used that for rental assistance, utility assistance, food, and their fight against COVID-19. So that that's $65 billion will again get distributed to the counties similar to the way the CARES Act did. So again, we're hoping that the county will then use their funds to open up the same programs that they offered back in March all the way through the month of December. So that's the American Rescue Plan as it currently stands. Certainly isn't passed at this point, but that's the legislation as written and sitting in committee. Did want to give you an update as well. Part of that $260 million that I spoke about that the county had, they have opened up some of that money to the smaller municipalities within the county. And the city has a request in for a reimbursement of just over $500,000. About 60% of that, $318 million of that has already been, $318,000 has been approved, and we're waiting for approval for the other $195,000. And I did want to point out, because I know we have people who are not necessarily on every call, the City Council has approved $250,000 budget for the city vaccination program. So every time, as the chief talked about, these vaccinations that we're participating in, whether they're state-run or whether it's a city-run operation, the City Council has stepped forward. They have provided this $250,000 to ensure that the vaccination programs are running at their optimal ability, and again, we can reach every citizen within the city. And that ends my finance report. Back to you, Ms. Noel.
Thank you, Mr. Sherman. And lastly, I'll be providing a report on our communications effort. You've probably heard it said many, many times about Code Red throughout this call, to include maybe information you're getting in the mail, you're seeing on social media and so forth. This is a very, very, very important mass communications technology for us as a city. Anyone who's been registered in our old emergency notification system, we will no longer be utilizing it. So we're asking that anyone who is registered on our old system would go and get themselves registered into Code Red. And I'm sorry, someone who's on the call, if you can please mute your line. There's a lot of feedback. Thank you. So as I was saying about the emergency notification system, so we're encouraging every resident, it's even open to businesses, visitors, anyone really who has a stake in this community who could benefit from getting notices as important as COVID-19 related circumstances like the vaccinations, testing, anything that can come in the future. That's going to be our primary method to reach everyone. To Chief Kurt's point about hurricane season coming up, water utility notices, things of that sort. We highly encourage that you register to Code Red. I will provide you with the information on this call as to how you can do so. There are 3 ways. The first is you can text to enroll. You simply have to text the word RB alerts, R as in Riviera, B as in beach, alerts, to 99411 to register through your mobile phone. Or you can register online by going to rivierabeach.org/Code Red. Or you can register by phone. You just have to call 866-939-0911. 1111, and then select option 2. That line is available Monday to Friday from 8 a.m. to 6 p.m. Next, the 2021 municipal election is coming up. That election will be taking place March 9th, which is coming very soon. And so we're putting out a lot of communication on that particular event. And so if you are not aware, you can get more information on the polling locations. You can request to vote by mail. And also you can find information on our upcoming charter amendment community meetings. On your election ballot, you will see charter amendments that are being proposed for you all to consider. And so that information will be available for you. We're looking to hold 2 meetings, one February 22nd, which will be virtual, and then one March 1st, which will be physical. In addition, you do have candidates running for the City Council District 4 seat as well. So just be aware of these things. And there's a lot of information going out, and we are utilizing Code Red as well for that. So if you register into Code Red, you can also select to receive notifications about community events. So with that being said, that is all that I have for communications at this time. And so we will open the floor to anyone who's joined this call to ask any questions on what was shared. So if you've called in, you can dial *9 so that I can unmute your line, and I will give it a few seconds. All right, seeing that we don't have a question at the moment, before I end, I just want to let everyone know that these are regular bi-weekly calls. So our next call is scheduled for Thursday, February 25th at 6 p.m. We will have our elected officials on the line. So we look forward to seeing you, and we ask that you invite everyone you know to participate in that as well. Information is constantly developing, and we want to get it out to you as soon as we can. Thank you, and have a good night.